Hello, this is the second PowerPoint for week 3. This PowerPoint will cover chapter 8, which is the nurse as learner and teacher. The objective for this chapter is describe the various teaching roles of the nurse. There are different ways of learning that they include formal academic education, institutional-based human resource development programs, such as orientation programs when you start a new job, equipment updates, to prepare for certification at specialty or advanced levels, and the intent is usually to benefit the institution. However, it also benefits the nurse. There are also continuing education programs. They are more specific and shorter than advanced academic degree study. They are individually driven and institutionally based. State or professional organization may mandate continuing education, and some states even require specific content instruction. For example, New Jersey requires all RNs attend a continuing education program on organ donation. C requirements must be met for each state where a nurse holds a license, and also continuing education is required to meet certification and or recertification for specialty practice. There are also individually selected educational activities. These are usually distinct and separate from formal or planned activities. The individually selected educational activities may be found in journals, newsletters, newspapers, and magazines. Okay, so there are theories of learning. We're going to talk about the learning process now. The 5 contemporary theoretical constructs include behaviorism, cognitivism, humanism, categorization, and constructivism. So behaviorism, theorists believe that the environment influences behavior and how a person controls it. Environment is an essential factor determining human action. An act is a response that is traced to the effects of stimulus. Example of behaviorism includes Skinner's operant conditioning theory, its classical conditioning, and association with the new stimulus such as Pavlov's dogs. The frequency of a response can be increased or decreased depending on the extent it is reinforced. Reinforcement is a consequence of an action. Extinction is the process in which a conditioned behavior is unlearned. The social learning theory, or social cognitive theory, states that the learning process involves 3 highly interdependent factors. They include the characteristics of the person's behavior, and the environment. Social learning theory suggests there is reciprocal determinism, that it's believed that the behavior affects or creates the environment, and also observational learning, which is acquisition of new skills and alteration of old behaviors. They also suggest there is imitation and modeling in the learning process. Cognitivism is a learner's perceptions are influenced by personal characteristics and experiences. Social, emotional, and physical contexts affect learning. Developmental readiness and individual readiness are other key factors. Major cognitive theorists include Piaget. So, as you recall from previous courses, I'm sure, there are 4 favorite phases: sensory motor, pre-operational, concrete operations, and formal operations. Each one of those phases has 3 primary abilities. The first one is assimilation, the second one is accommodation, and the third is adaptation. Okay, the learning process, Bloom's domains of learning. This was nursing school. You need to learn in 3 different domains. The first one is the cognitive domain. An example of this would be when you attend a lecture and you learn the content of the lecture. The second would be the affective domain, and the third is the psychomotor domain. An example of psychomotor domain is when you would attend clinical and actually do a skill such as an IM injection. So it's actually doing the task. Humanism focuses on cognitive and affective areas of the learner. It's a holistic philosophy of care. Prominent theorists for the humanism is Abraham Maslow and Carl Rogers. They believe that learning is to be self-motivated, self-initiated, and self-evaluated. Learning focuses on self-development and achieving their full potential. So constructivism, theorists for constructivism are John Dewey and Bruner. It's a change in meaning constructed from experience. Knowledge becomes an individual interpretation of an experience. Learning is the construction of new interpretations, and it's applicable to learning technology. So, learning considerations. The first things that we have to consider is motivation. Is there an incentive to learn? It influences how quickly and how much a person can learn. And it is greatest when a person recognizes a need. The need must be expressed by the person. We also have to consider readiness. Motivation will be affected by readiness. If they're not ready to learn, then their ability to learn will not be as great. You also have to consider making the person actively involved. If you make a person actively involved in the learning, then it becomes more meaningful. Active participation in planning and discussing results also result in faster learning and better retention. Passive learning of just sitting at a desk and taking notes does not foster optimal learning. A person expects to be judged poorly will not learn as well a person who feels no such threat. So it's important for educators or nurses as educators not to intimidate the person or believe that they cannot do well. Feedback is very, very important. Information or critiquing related to a person's performance to a desired goal is essential. You need to support the desired behavior through praise, positively worded corrections, and suggestions of alternative methods. Negative feedback may cause the person to avoid the teacher, to avoid the punishment. Another consideration is to make the learning simple to complex. So learning will be facilitated by material that is logically organized and proceeds from the simple to complex. Repetition is a learning consideration. This helps link new learning to prior learning. Timing. You need to remember timing, and that is exactly why I broke the PowerPoints up. Learners retain information and psychomotor skills when the time between learning and use is short. So short PowerPoints compared to the long 30-minute PowerPoints will hold your attention. And also the time between the learning sessions, if it's short, will also help with the learning process. The environment, there has to be an optimal learning environment. That means that you need a quiet place without distractions. Physical and psychological comfort, there are also considerations with learning. Emotions greatly influence learning. So if somebody is very anxious, that will impede their learning. Physiological factors such as pain, impaired hearing, critical illness will also impact the person's ability to learn. It actually affects the ability to concentrate. There also are considerations as far as cultural and spiritual barriers. There may be language or value differences. So we need to take this all into consideration. The other thing we need to take into consideration, the last one on that list, is health literacy. We may go in a room with written instructions, and the person may not be able to read those written instructions, so then therefore the written instruction is of no value. So you have to determine the degree to which an individual has the capacity to obtain, process, and understand basic health information and services. That includes written and verbal. Okay, the art of teaching is goal-directed activity that results in improved learning for the learner. It's more than just giving information. It provides the knowledge, skill, and desire within the learner to change some aspect of his or her life, and it requires strong social and communication skill. As far as nursing, our nursing roles in teaching, we may teach individuals, we may teach groups of patients or other individuals. We also have to realize that there may be different types of learners. We may teach clients and their families. We may teach other healthcare professionals, such as if you provide continuing education. You may be involved in teaching staff. You may be involved in teaching the community. So there's also a variety of settings that you may be teaching in. Instruction may include self-care, such as taking medications. Effective teaching requires knowledge of the subject matter, understanding of the learning process, judgment, and intuition. A relationship between the teacher is essentially one of trust and respect, so that is so important when you are teaching. Nurses have the responsibility to keep their clinical knowledge current. So that is why this chapter is on the nurse as teacher and learner. Teaching activities should help the learner meet individual learning objectives. There needs to be a rapport between the teacher and the learner. You need to use the client's previous learning situations in the present situation. So that means if you can relate the teaching to something that the patient or client already knows, that they will be able to learn it better. You need to communicate clearly and concisely. You need to know the learner and the factors that affect that person's learning before teaching. You need to involve the person in the learning. You need to use strategies that use multiple senses. So some people are visual learners, some people are auditory learners, some people are kinesthetic learners. So if you can involve vision, hearing, and touching, or actually doing tasks, that will strengthen the learning process. Anticipate behavioral changes relevant to the client's lifestyle and resources as well when you are teaching and learning. Other factors to consider include age and development, health beliefs and practices, cultural factors, economic factors. For instance, you're not going to instruct a patient that they need to drive somewhere for daily dialysis, and it's very important for them to do so, and yet they do not have the means to pay for the dialysis or pay for the diabetic supplies. You also need to address the learning styles, which is what I just mentioned, as far as visual, auditory, and kinesthetic learning. You also need to address the readiness to learn. If somebody is not ready to learn, then you will not be able to teach them. Again, the motivation level of the person and also the reading level. So planning content and teaching strategies are accomplished in a series of steps. You need to determine your teaching priorities. Setting learning objectives or outcomes before the learning process will assist. You need to state the learner behavior or performance that is expected. Reflect an observable, measurable behavior. You may add conditions or modifiers for clarity. You need to include specifying the time by which learning should have occurred. When you are choosing the content, what is taught is determined by the learning objectives. Content should be accurate, current, based on the learning objectives, and adjusted for the learner's age, culture, language, and ability. And it needs to be consistent with information the nurse is teaching. It should be selected with consideration of how much time and resources are available for teaching. When you select your teaching methods, The methods should definitely be suited to the individual, so you need to take into consider all factors. As far as guidelines and implementing a teaching plan, you need to schedule the best time for the learner, pace the session appropriately, control the environment and avoid distraction, use teaching aids, assist learner discovery assist the learner to discover content for themselves. In addition, use repetition, organize the information, use layperson's vocabulary, and provide written material for future reference. Just make sure that they are able to read and understand the material that's given. Okay, so now that the teaching process is over, you need to evaluate the learning and teaching process. So, ongoing evaluation is known as formative evaluations, and the final evaluation is known as summative evaluation. Evaluations may include observations, such as when you were a nursing student and your clinical instructor watched you administer medications. There also are written evaluations. That would be an example of that would be a written care plan. You could also do oral questionings. You can do self-reports and self-monitoring. You can do demonstration and return demonstration, especially for psychomotor skills. You need to consider all factors when evaluating teaching. You need to consider the timing, the environment for learning, your teaching strategies, and the amount of information that was provided. You also need to know if the teaching was helpful. The teacher and the learner should evaluate the learning process or the learning experience, and you need to have the learner be active in the learning process. That is very important. Transcultural client teaching, some guidelines. Obtain teaching materials in languages used by the client. Use visual aids such as pictures, charts. Use concrete rather than abstract words. Allow time for questions. Avoid use of medical terminology. Validate in writing if pronunciation is a problem. Use humor cautiously. Avoid slang. Don't assume that a nod means that the person understands. Invite and encourage questions, and consider same-sex teacher if content is related to personal areas of the body, and include the family. And also, there are many hospitals now have the translator phone, so you may want to use the translator phone so that you can ensure that the person is understanding what you're teaching. Okay, so as just like nursing care, you need to document the teaching. So you need to include diagnosed learning needs. You need to include the learning objectives, the topics that were taught, the client learning outcomes achieved, need for additional teaching, and resources provided. A written teaching plan is a resource and should include actual information on skills taught, the teaching strategies that were used, time, framework, and content of each class. And that's the end of this PowerPoint.